Good evening. I am Dr. Rakha Guleria, a senior consultant at Fortis La Femme, GK2. I would just like to talk about a few points regarding pregnancy in this time of COVID-19. Pregnant women are very susceptible to any sort of infections because they are already in an immunocompromised state. So they are prone to catch infections more easily than anybody else. So in this regard, ladies who are pregnant should avoid going out, should wash their hands frequently with soap and water, and use sanitizer as and when required. The other question comes, when should we or can we go and meet our doctors? We, as a community of doctors, are now advising our patients to talk to us on the phone. We will answer their queries on the phone. We are offering teleconsultation so that we can clarify any doubts, see any reports which the patient has, and give them a prescription regarding any of their problems. We are not encouraging everybody to come to the hospital. Come to the hospital only when you have an emergency, when you have a problem, then we will see you immediately. There are few conditions or times in pregnancy when we call you definitely. The first is the initial visit. When you discover that you are pregnant, then yes, definitely you must come and show us immediately so we can determine the pregnancy. We can do an ultrasound to make sure the pregnancy is inside the uterus and there are no other problems. Your next visit is around 11 to 13 weeks when we do a ultrasound, which is called the NT-NB scan, in which we again see if there is any problem in the pregnancy, any problem in the development of the baby. At the same time, we do a test which is called a dual screening test, which also rules out any abnormality, genetic abnormality in the baby. Your next visit is usually around the 20th week of pregnancy, when we do a detailed level 2 ultrasound in which we see all the organs and the development of the baby. That is the time when we give you your first tetanus shot also. So these visits are mandatory. Other than that, if you have any problem, we are advising you to talk to us first before coming to the hospital. You must always wear a mask when you step out of the house or even when you're coming to the hospital. Gloves are not really required. Just wash your hands with soap and water. Regarding diet and nutrition during this time or during pregnancy in general, well, at this time you are confined to the house. So yes, you're not going to feel so hungry and you're not going to be able to digest all your food as you would otherwise. So I would advise you to take small, frequent meals, not very heavy, but rich in protein, and you must consume a lot of fruits and vegetables. Drink lots of water. You can have plain water, you can have coconut water, you can have nimbu pani, you can make lemon water, or you can make fruit infusions and have them. These are all helpful and healthy for you. Try and walk in the house. Do some sort of exercise, light yoga. Walking is good. You can do some household chores, nothing very heavy like washing clothes or swabbing the floors, but yes, you can do dusting, you can do some ironing, so it keeps you busy. And your last meal, your evening meal, should be light so that you'll be able to digest it better. And if you have any further queries, please feel free to talk to us, to talk to me, to talk to your doctors. Thank you.